Hi guys, welcome to day 7 of the Arora AKT 30-day challenge. Hopefully you've been joining us for days 1 to 6. If you haven't so far, please do visit the YouTube channel, Dr. Amin Arora, and watch those 6 questions back. Day 7, our first admin question. I'm not sure if at this stage you've started to do any preparation for the admin part of the exam. A lot of people leave it till the end. So let's see how you get on with this question. Like every day, we're going to run a live question, 57 seconds. Have a think about it. Try and plan what you put in that time pressurized environment. Use technique, use knowledge, and the combination of the two can hopefully get you to the right answer. And then we'll go through the answer and then go through a quick teaching point that goes around that particular topic. So without further ado, let's start the question. I'm going to start 57 seconds, have a read and see what you think. Okay guys, that is time. 57 seconds. So the answer here, by the way, is B. Well done if you got B. You're reviewing the Mental Health Act as part of a leadership quip in your GP rotation. Which of the following combinations matches in terms of the various sections in relation to mental health? And we'll go through all of the sections one by one that are relevant to general practice and the key things that you need to know. But the one that is true, or the one that matches correctly, is option B. Well done if you got this right. Section 3. One doctor completing a Section 3 must be Section 12 approved. I'll talk about what Section 12 means in a second. That's true. All the others have an anomaly to make them incorrect. So Section 4, for example, doesn't last 24 hours. It lasts 72 hours. We'll talk about this in a second. A Section 5.4 often gets confused with a Section 5.2. So this is incorrect. A Section 5.4 is when a nurse can hold somebody in hospital for up to 6 hours if they have a mental health illness that needs treatment, for example. We'll talk about this in a second. A Section 135 is the one that allows forced entry into a property, and we'll talk about this in a second as well, not a Section 136. And this is incorrect. Section 2 needs 2 doctors in order to complete a Section 2, not 1 doctor. There are some sections that just need 1 doctor, which we'll talk about in a second, but a Section 2 needs 2. So the only one that was correct here, the only one that matches, is B, Section 3. One of the doctors completing must be Section 12 approved, which we'll talk about in a second. So well done if you got this right. So let's go over some key things. Sorry, this is incorrect. This should say B, not D. I forgot to change that. So B was the right answer, as we just talked about. So what are the key things that you need to know from a Mental Health Act point of view? So there are lots of pieces of legislation, certification that are important from the organizational or admin section of AKT, and often neglected part of AKT. And we have courses separate for AKT admin, whether it's our online course or our audiobook course, but either way you need to cover the material. So the Mental Health Act then, so it covers detaining and treating of people with a mental health disorder or suspected mental health disorder, and there are various sections. These are the ones that I think are more appropriate to the general practice setting or knowing for this type of exam. There are obviously lots of other things in that Mental Health Act that you can read and learn as well, but these are the core things that I think stands out. So let's look at Section 2 first then. Section 2 allows for compulsory detention for assessment plus or minus treatment for up to a maximum of 28 days. And so if you think that someone may benefit from a formal assessment plus or minus treatment, then you can use a Section 2. There needs to be 2 medical recommendations present to carry out a Section 2, and one of those doctors needs to be approved under what we call Section 12. So a doctor who's approved under Section 12 has additional training, it's usually a psychiatrist, for example, or a GP with a specialist interest, who has additional training under the Mental Health Act, and they're called Section 12 approved. So one of those doctors needs to be Section 12 approved, but the other doctor doesn't need to be. So that's a Section 2. A Section 3 allows for compulsory detention for treatment, and that's for up to 6 months, so much longer. So Section 2 is for 28 days maximum. Section 3 is for treatment only, and that's for up to 6 months. The patient must suffer from a known mental health disorder, whereas in Section 2, because it's for assessment, they don't already have to have a diagnosed condition. With Section 3, they do, because it's for treatment only. Again, 2 medical recommendations are needed, and one of them, again, needs to be approved under Section 12. So if you look at option B here, Section 3, one doctor completing must be Section 12 approved. That's the true one. That's the one that matches. Section 4 then, so allows for emergency detainment for assessment, so just for 72 hours. So, and because it's the reason it's a short period of time is only one doctor is needed to carry out a Section 4, and they must have examined that person within the previous 24 hours. And usually a Section 4 is converted into a Section 2 once a second doctor comes along, and that second doctor needs to be Section 12 approved. So 72 hours is for emergency detainment for assessment, and if needed, this could be converted to a Section 2 to give you the 28 days for further assessment plus or minus treatment. But Section 4 just needs the one doctor, and that's why it's an emergency situation, whereas Section 2 needs those 2 recommendations like we mentioned. Then we have Section 5, which, like I mentioned, can get confusing. There's Section 5.2 and Section 5.4. This allows a healthcare professional, doctor or nurse, to stop someone from leaving hospital. So a Section 5.2 is when a doctor can hold someone from leaving with a known mental health disorder, for example, for up to 72 hours. And a Section 5.4 is when a nurse can stop someone from leaving for a maximum of 6 hours. So if you look back here, Section 5.4, doctor. So it's a nurse here as opposed to a doctor, which would make that a true statement. Then you have Section 135 and 136, which often get confused. So Section 135 allows a magistrate to authorize forced entry into a property where it's believed that the person inside is suffering from a mental health disorder, and that can last for up to 36 hours. So Section 135 is where a magistrate can allow forced entry to a property where the person inside is believed to be suffering from a mental health disorder. And then Section 136 allows a police officer to detain somebody to a place of safety if they're in a public place and they think they may be suffering from a mental health disorder. And that lasts 24 hours, but it can be extended in certain situations to 12 hours. So Section 135 is about forced entry into a property. Section 136 is allowing someone to detain to a place of safety if someone with a mental health disorder or suspected is in a public place. So there are many other sections and elements of the Mental Health Act, but these are the ones that I think are really important to know for an AKT type assessment, things that might come up in a question. Section 2, Section 3, Section 4, Section 5, Section 135, and Section 136. So as you can see, answer B here was the correct answer. That was the one that correctly matched, not D. Just ignore that. But hopefully this makes sense from a Mental Health Act point of view. One other thing to talk about tonight, and I know a lot of you guys have started to use our 5 mock exams. We have 5 full AKT mock exams. They're quite challenging, so people often come back to me and say, what's the kind of score that I'm looking for? We put them at a high level so that you're getting prepped for high level questions. So when you go to the exam, you're not kind of surprised, because sometimes what I hear is that people say all the questions that I've been doing up to point have been fine, and then the exam is actually quite tricky and random and challenging. So we have 5 online mock exams. You can get a full 5-in-1 bundle at a discounted rate. You can get a triple pack, which has 3 in there, or you can buy individual exams as well. So if you buy the 5 bundle, it's 1,000 questions in total, and we have a minimum of 5 key learning points per question. So hopefully you'll get 5,000 strong learning points if you get the 5-pack. You can get them for 1, 3, 6, or 12 months depending on when you're doing the exam, and you could do them multiple times in that time frame, and all of your various attempts will be stored, and each time you do the exam it'll be a randomization, so you'll get a different order. So the questions, like we said, are pretty challenging. It's set out in the way for that you'll get in the exam, so you can flag questions, go back to them, etc. The explanation is a bit that we've worked really hard on. We've tried to stay away from the, here's reams and reams and reams of reading that you need to do. And like we mentioned, we've kind of split it into 5 really short, sharp, high value points per question. So it doesn't take you a long time to read and therefore learn and therefore take away key points going forward. One other feature that we have is that you can add extra time to your exam. So the exam is set to 3 hours 10 like the real exam. But if you have extra time in the real AKT, then before you start your paper, you can add that extra time so it replicates what you're going to get on the day. And then when you get your feedback, obviously you get your percentage, but you get your breakdown of scores in the variety of areas that you need to know. So admin, stats, clinical, but the clinical is split up into different categories within clinical itself. So endocrine, ENT, dermatology, etc. So it gives you an idea as to where to go and focus your work going forward. So there are some samples on the website. You can go to the website aurora.medicaleducation.co.uk, click take the sample AKT mock. I think there are 10 questions that you can do just to get a flavor of the types of things that we do and play around with the system. And then if you're going to go for one of the bundles or any of the individuals, please do use the coupon Aurora Video 10 to get that 10% discount. Remember, that's site-wide. So whatever you do for AKT, you please use this coupon if you watch this video, and it gives you 10% off anything that you might need. So hopefully that's the first of, we're going to do several admin questions as we go through the next 20 odd days. Join us tomorrow for day 8. We'll be back onto a clinical question tomorrow. And thank you so much once again for all the kind words that have come in for these videos. I'm really glad that you're finding them some value. And if you know of anybody else that might find these of value, please do point them in the direction of the YouTube channel. And a couple of you guys have been asking, how do I find the previous ones? If you go to the YouTube channel and go to our playlists, you'll see the AKT 30-day challenge. If you click on that playlist, you'll see them all, and I'll be added to that on a day-by-day basis. Hope this helps, guys. Take care. Have a good day. We'll see you tomorrow. Hashtag Campus Will Pass. Hashtag I went with Aurora.